This week, we will recognize World Bipolar Day to bring the world population information about bipolar disorders and educate to eliminate the social stigma surrounding the illness. Joining us now to discuss bipolar disorders is Carrie Krawiec, a therapist at the Birmingham Maple Clinic, for our weekly mental health segment. Carrie, thanks for being with us.
Good morning. Thank you for having me.
Yeah, glad to have you on as we are right around that time of the year where we are recognizing World Bipolar Day to bring some awareness to bipolar disorders. And much like many other mental health or cognitive disorders, there are a variety of different ways that bipolar manifests in people. So let's just start from the baseline and explain what is bipolar, what are bipolar disorders?
Bipolar disorders are a chunk of similar disorders that are all part of mood disorders, which mood disorders include depression. So where bipolar disorders differ from depression is that in addition to depressed episodes, they also include what's called a manic or hypomanic, which just means sort of a less severe version of manic episode as well.
And so who does this typically affect? Does it affect people at an earlier age or at an older age? What are the demographics on this?
I think that the most common age of diagnosis happens to be right about the mid-20s, like about 25 years old. And typically we see the symptoms associated with bipolar disorders between 18 and 29. There are cases now where people believe they're seeing them in younger children, but all of that research has not yet evolved.
And that's got to make it a little bit more of a challenge to address these issues and really fine-tune where among the different definitions of bipolar disorders someone may be affected, because in some cases with men in particular, we know around 25 years old is the time where their brains, where the frontal lobes have fully matured, and so that's the point where you're really seeing that development, if not come to an end, be near its point where it's as far as it's developed. And that's where these problems, if they have manifested or if they are taking full effect, can really have a major impact on their life. So typically, where does that diagnostic process start in terms of bipolar disorders?
You're absolutely right. Bipolar disorders are of the hardest to diagnose, for one reason being that people, when they are depressed, are more likely to seek treatment. When they are in a manic or hypomanic stage, they may feel elated, have high energy, seem very goal-directed, and therefore not really suffering. So sometimes it's often misdiagnosed as depression because without seeing someone's full medical history, the presence of those manic or hypomanic episodes are not fully understood even by the patient themselves. Also, like you said, of course, there's the science is incomplete on what might cause bipolar disorder. Certainly genetics and brain function do play a role, and family history as well. So although if you have a family member with bipolar, it's not a guarantee you would have it. If you have a parent or a first degree sibling, those are things that would increase your likelihood.
And according to the National Institute of Mental Health, about 2.8% of U.S. adults had bipolar disorders in the past year, and about 4.4% of American adults will experience a bipolar disorder at some time in their life. And because there are such varying forms of bipolar disorders and therefore varying forms of treatment, how effective are those treatments in, if not eliminating some of these symptoms, but taming some of these symptoms that can often be severe, but in some cases may just be benign and recurring?
Sure, I think in just kind of pop culture jargon, we use the term bipolar so often and so often inaccurately. It's really created a misunderstanding about what truly bipolar is. Bipolar is a very serious mental health diagnosis that can have very severe consequences and does need to be taken seriously. And medication is usually always involved, although there are different medications that treat different symptoms. Some medications treat the depressive episode, whereas others treat the manic episodes. And for some people, a depressive medicine can actually initiate their first manic episode because it's taken their mood too far to the other direction. So these things need to be done very closely with a trained psychiatrist. And it really is sort of a trial and error for each individual patient to see which medications are helping their symptoms. as best as possible. Certainly talk therapy can help people, especially just to cope with their own issues with their behavior in one episode or the other, or how they're treated by friends and family, and to sort of, come to a good place in their own esteem about who they are as a person, and what are their symptoms, and also just executing the self-care and coping necessary to also predict and plan for episodes as they arise.
March 30th is World Bipolar Day, and joining us to talk about bipolar disorders is Carrie Krawiec from the Birmingham Maple Clinic for our weekly mental health segment. And Carrie, in terms of treatment, going back to treatment and diagnosis for mental health professionals like yourself, or others in the profession like psychiatrists that would be on more the diagnostic side, neurologists on more the diagnostic side, what are some of those behavioral factors or physiological factors that are being watched out for as adults particularly are approaching that age, around that 18 to 29 range, as you mentioned earlier, where bipolar disorders are typically diagnosed?
So, like I said, people mostly enter into treatment when they're in a depressed episode, and actually, bipolar patients tend to have more depressed episodes than manic episodes or hypomanic episodes, anyways. So, again, it seems like they're spending more of their sort of symptomatic part of their life as depressed. So, of course, with any depression, we're looking at feelings of hopelessness and worthlessness, fatigue, extreme guilt, low self esteem, poor body image, thoughts of suicide or self harm, difficulties falling asleep, staying asleep, or oversleeping, under eating and overeating. So, any of those things that just where a person is in a state of, like hopelessness and despair.
BirminghamMaple.com is the place to go for information on getting in contact with Carrie and the professionals at the Birmingham Maple Clinic. You can also give them a call, 248-646-6659, 248-646-6659 for more information. And you mentioned some of the different ways that bipolar disorder can affect someone. You mentioned that the depressive or the lows are typically more common in terms of those mood swings than the manic or hypomanic episodes that may be associated with a bipolar disorder. But that being said, regardless of which way the pendulum proverbially may be swinging, bipolar disorders can be lethal for those that are affected, especially if they're on the more severe side. So now, how does that factor into really the importance of getting in front of this issue as early as possible and finding that right treatment for that right person and their specific case?
Sure. Like I said, on the sort of extremely manic side, more than just elevated mood and energy, you may see people engaging in high risk or dangerous behaviors. You may see people experimenting with substances or, again, other things that they wouldn't ordinarily, having extreme sleeplessness or insomnia, maybe even having some psychosis or, delusions, or that are changing their sort of perception of their reality and what's around them. So yeah, all of those things have the potential to be very dangerous. And it's with the support of family too, and other people to maybe, instigate this as more than just, a lot of energy or a really good mood.
We're joined by Carrie Krawiec, a therapist at the Birmingham Maple Clinic, for a weekly mental health segment on the Megacast. You can find all these segments on demand on our website, civiccentertv.com/Megacast. And you can also learn more information and get in contact with the Birmingham Maple Clinic at their website, birminghammaple.com, or ask them some questions. info@birminghammaple.com is their email address. Carrie, as we think about World Bipolar Day coming up on March 30th, and the point of a day like this is to eliminate some of the stigma, to learn more information, and have a better understanding of something that is complicated like bipolar disorders, and like any other stigma, whether it's surrounding race or gender or sexuality or other mental health factors that can often be judged by the general population. Understanding sort of that day-to-day, those experiences, is a really important element of eliminating that stigma. So in terms of the day-to-day for those that are affected by bipolar disorders, what can that look like, both on the more benign side, not to minimize those symptoms, but also on the more severe side, given that it is typically characterized by mood swings?
Like I said, mostly they're just like us. They're people just like us. They're talented and successful and have wonderful jobs. There are many documented people that are famous, and so I mean, their days are just like us. But I mean, I think with the added of maintaining some consistency in medication, some self care, tracking, what are sort of the things, what are the signs and symptoms that they notice that perhaps a mood is changing, and just being aware and informed about how to take care of themselves. It would be like any chronic health issue, whether it was something like diabetes or something like that, where you just have to stay on top of it. And the better care you take care of yourself, and the sort of awareness and support you get from your family is always going to be helpful to you. It can be challenging, especially in some of those younger adult or later adolescent years, to have a family member with bipolar. But as families, trying to monitor giving a person their independence and their autonomy without being too overly intrusive or controlling, which can exacerbate symptoms, or without also being too sort of hostile or critical, which can exacerbate symptoms as well. So trying to be useful and helpful without overstepping.
And not to encourage any sort of self-diagnostic behaviors that can often just lead to a bunch of anxiety, but for individuals really having that inventory of their mental health and the way that they're feeling on a day-to-day basis, on a regular basis over the course of weeks or months or even years can be really important for getting out in front of some of these mental health issues, whether it is a bipolar disorder or some other issue that may pop up or may have been present for a long time. So for those that may be doing that inventory at this time of the year or at other parts of the year and of their life, what sort of symptoms should they be looking out for? What sort of behaviors, if they're doing their reflecting, should they be maybe listing down and thinking, okay, this might be something that could indicate maybe I need to go in and talk to a professional and see if there is something diagnostic going on here, so that if, for example, they are affected by a bipolar disorder, they can get out in front of that, because as you said, that treatment, that consistency with that treatment is so important for them to be able to live a regular and healthy and enjoyable daily life.
Sure, just like we said before, of course, the presence of anything concerning, like thoughts of self-harm or suicide, anytime where your symptoms seem to be disrupting your life, if they're interfering with hygiene, eating, sleeping, if it's interfering with personal relationships or work, certainly if there's some sort of like core features of your life that can't be maintained while you're symptomatic, would absolutely be a sign to get some treatment.
More information and ways to get in contact with Carrie and the other professionals at the Birmingham Maple Clinic can be found at birminghammaple.com or by calling them 248-646-6659. You can also join Carrie Krawiec and I each and every week for a mental health segment here on the Megacast, and find us on demand, civiccentertv.com/Megacast. Again, March 30th is World Bipolar Day, as we recognize the symptoms and the different ways that bipolar disorders can manifest in people, and it manifests equally between men and women, the average age of onset being about 25 years old. And according to the National Institute of Mental Health, over the course of a lifetime, 4.4% of American adults will experience bipolar disorder in some way or another personally. So Carrie, a couple more minutes with you before we'll need to move on for today. Anything else that we haven't discussed about bipolar disorders that would be important to keep in consideration at this time, especially as we recognize World Bipolar Day on March 30th?
I think, like I had mentioned earlier, bipolar, perhaps more than any other mental illness, is one that we use and throw around as kind of maybe even derogatory to ourselves or our peers. Oh, that person is so bipolar. We're using it inaccurately, and you don't know, like you said, with such commonplace, whom you may be hurting by describing somebody else that way. That it's not just a change in mood or behavior where someone goes from a seemingly good mood and a bad mood across the course of one dinner. These are mood symptoms that are bigger and may last days or weeks, and can be very debilitating. And so it's not just that kind of fluctuation. If we know a person whose personality seems to go from hot to cold, it's not really the same thing. And when we use the word bipolar to describe that, perhaps we're hurting that person, but we may also be hurting someone who's actually diagnosed and or muddying the waters so that it's not clear when to seek treatment. Am I just going because my personality and, changes, dramatically from one minute to the next, or am I dealing with something serious here?
All comes down to a little bit of kindness as we recognize these different forms of mental health issues that may pop up in all of our lives and we may not be aware of on a day-to-day basis. Carrie, thank you so much for joining us and explaining more about bipolar disorders and a number of different ways it manifests in our communities.
Thank you for having me.